Turning 65 should be a milestone filled with joy, but for many Americans, it brings a confusing new challenge. Medicare. Have you ever looked at all those parts A, B, C, and D and thought, this looks like alphabet soup? You're not alone. In this video, we're going to break down Medicare in the simplest way possible. You'll learn what Medicare really is, the 4 parts you need to know, what it does not cover, the biggest mistakes seniors make, and how to choose the right plan for your health and your wallet. By the end, you'll feel confident and ready to make informed decisions. Let me share a quick story. A gentleman named George from Ohio just turned 65 last year. He thought Medicare would cover all his medical costs, so he skipped learning the details. But when he needed dental work, he was shocked to discover Medicare didn't cover a single dollar. George said, "I wish someone had explained this to me in plain English before I signed up." That's why we're here today, because knowing the truth about Medicare isn't just paperwork. It's the difference between peace of mind and painful surprises. So let's start from the very beginning. What is Medicare and why does it matter so much after 65 it is? What is Medicare and why it matters after 65? When you turn 65 in the United States, you're automatically introduced to Medicare, a national health insurance program created back in 1960. The idea was simple: give older Americans affordable health care at a time in life when medical needs usually increase. But while the goal is simple, the system itself can feel overwhelming. Medicare has 4 main parts. Part A, hospital insurance, covers hospital stays, skilled nursing facilities, and some home health care. Part B, medical insurance, covers doctor visits, preventive services, and outpatient care. Part C, Medicare Advantage, private insurance plans that bundle A and B, often with extras like vision or dental. Part D, prescription drug coverage, helps cover the cost of medications. Why does this matter so much after 65? Because according to the National Institute on Aging, more than 80% of adults over 65 live with at least one chronic condition, such as diabetes, arthritis, or heart disease. Without Medicare, the cost of treating these conditions could be devastating. For example, the average annual cost of insulin without insurance is over $5,700 in the US, an expense most retirees cannot afford. Let's put this into a real-life story. Mary, a retired school teacher in Texas, didn't realize how important Medicare was until her husband had a stroke. The hospital bills alone reached nearly $40,000. Without Medicare Part A and B, they would have been forced to drain their retirement savings. Instead, most of those costs were covered, giving them financial stability during a stressful time. Medicare is not just another government program. For seniors, it is often the line between financial ruin and security, between delaying treatment and getting care right on time. Now that we understand what Medicare is and why it's so critical after 65, let's move into the common misconceptions and mistakes that seniors often make when dealing with it. The 4 parts of Medicare. A, B, C, D, explained clearly. If Medicare feels overwhelming, you're not alone. Many seniors say it's like learning a new language with all the letters. A, B, C, D. But once you break it down, it becomes much easier to understand. Let's go step by step. Part A, hospital insurance. Think of Part A as your safety net if you ever need to be admitted to the hospital. It covers inpatient stays, hospice care, and limited stays in skilled nursing facilities. Most people don't pay a premium for Part A if they've worked and paid Medicare taxes for at least 10 years. But be aware, it doesn't cover everything. For example, long-term care or personal aids are not included. Part B, medical insurance. Part B is what covers your day-to-day medical needs. Doctor visits, outpatient care, lab tests, preventive screenings, and even medical equipment like walkers or wheelchairs. Unlike Part A, you pay a monthly premium for Part B. In 2024, the standard premium is around $174.70 per month. Skipping Part B can be risky. Without it, even a simple visit to the doctor could cost hundreds of dollars. Part C, Medicare Advantage. This is where things often get confusing. Medicare Advantage Part C is not just an extra, it's an alternative. Instead of using original Medicare, A plus B, you can choose a private insurance plan that bundles them together, often with extras like dental, vision, hearing aids, or even gym memberships. Some seniors love the all-in-one simplicity, while others prefer the flexibility of original Medicare. Part D, prescription drug coverage. Medications are often one of the biggest expenses in retirement. Part D helps cover prescription drugs, and the plans are offered by private insurers. Costs vary, so it's important to compare what medications you take against what each plan covers. Missing Part D enrollment when you're first eligible can lead to lifelong penalties. Real-life example. Let's take Robert, a 68-year-old retiree in Florida. He had to decide between original Medicare, Parts A plus B plus separate Part D, and a Medicare Advantage plan, Part C. Robert takes several daily medications and wanted dental coverage. After comparing costs, he chose a Medicare Advantage plan that covered all of these in one package, saving him about $120 per month. But his neighbor, Linda, stayed with original Medicare because she valued being able to see any doctor nationwide without referrals. Many seniors think Part C is just an optional extra, something you add on top of A and B, but that's not true. Choosing Part C usually replaces your original Medicare with a private plan. That's why it's so important to understand the trade-offs before you sign up. Each part of Medicare has pros and cons. The key is not to ask, which is better overall, but instead, which fits my personal health needs and lifestyle best? Now that you know the 4 parts of Medicare, let's talk about enrollment and timing. One of the biggest areas where seniors accidentally lose money: costs, premiums, and what Medicare doesn't cover. When most people first hear about Medicare, they breathe a sigh of relief. Finally, healthcare is taken care of after 65. But here's the truth that surprises many seniors: Medicare is not free. Understanding the costs up front can save you from stress and unexpected bills later. Premiums, deductibles, and copays. Just like other insurance, Medicare has 3 types of costs. Premiums, the monthly fee you pay to have coverage. For 2024, the standard Part B premium is about $174.70 per month, according to the Centers for Medicare and Medicaid Services, CMS. Deductibles. The amount you pay out of pocket each year before Medicare begins to share the cost. For example, in 2024, the Part B deductible is $240. Copays coinsurance. Your share of the bill after Medicare pays its part. This could be 20% of a doctor's visit or medical equipment cost. What Medicare does not cover. Here's where many seniors get caught off guard. Medicare does not cover dental care, routine checkups, cleanings, dentures, vision care, eye exams, glasses, contact lenses, hearing aids and related exams, long-term care such as staying in a nursing home or having a home health aide long-term. These are some of the biggest expenses in later life, and many seniors only realize this when the bills arrive. Take Mary, a 72-year-old retiree in Ohio. She went in for a simple dental checkup and ended up needing a crown. The bill was nearly $2,200 out of pocket because Medicare doesn't cover dental care. Mary admitted she assumed Medicare would handle it. Unfortunately, many seniors make the same mistake and feel blindsided by costs they didn't expect. The biggest misconception is thinking that Medicare equals free health care. It doesn't. Medicare is health insurance, with premiums, deductibles, and gaps. If you don't plan for these costs, you may face financial strain. Budgeting for out-of-pocket expenses is just as important as choosing the right plan. Many seniors choose supplemental insurance called Medigap to help cover what Medicare doesn't. Others look for Medicare Advantage plans, Part C, that include dental or vision. The key is to plan, not to be surprised. Now that we've covered costs and what Medicare doesn't include, let's move to Part 4, enrollment and timing, one of the areas where many seniors lose money by accident. Common mistakes and how to avoid them. One of the biggest challenges with Medicare isn't the coverage itself. It's avoiding costly mistakes. Many seniors lose thousands of dollars simply because they didn't know the rules. Let's talk about the 3 most common errors and how you can avoid them. Mistake number 1. Not enrolling at the right time. Medicare has very strict enrollment deadlines. If you don't sign up for Part B during your initial enrollment period, the 7 months around your 65th birthday, you could face a 10% penalty on your premium for every year you delayed, and that penalty lasts a lifetime. The Centers for Medicare and Medicaid Services, CMS, reports that tens of thousands of seniors pay higher premiums each year simply because they missed this window. Mistake number 2, choosing the wrong plan. Because it looks cheaper. It's natural to want to save money. But with Medicare, the cheapest monthly premium isn't always the best deal. For example, some Medicare Advantage plans advertise $0 premiums. Sounds great, right? But later, when you need specialist care, you might face high copays or limited networks. In the long run, that cheap plan could cost far more than you expected. Mistake number 3, not reviewing plan changes every year. Here's a detail many seniors don't realize. Medicare Advantage and Part D drug plans can change their coverage every year. That means the drug that was affordable in 2023 may suddenly cost triple in 2024 under the same plan. Every October, during the annual enrollment period, you should review your coverage to make sure it still matches your needs. Let's take Mr. Johnson from Texas. He assumed Medicare would just happen when he turned 65. He missed his enrollment window, and now he pays an extra $40 a month for life on his Part B premium. That's nearly $500 a year, and over 10 years, he'll pay almost $5,000 more than he needed to. All because of one missed deadline. The key takeaway is this: timing and awareness save you money. Enroll on time. Don't just pick the cheapest plan, pick the right plan. And review your coverage every single year. These small steps can save you thousands of dollars and ensure you're truly protected. Now that we've seen the pitfalls to avoid, let's look ahead to Part 5, how to get help and resources to make Medicare easier. How to choose the right plan and next steps for seniors. When it comes to Medicare, there is no one-size-fits-all. Every senior has different health needs, prescriptions, and budgets. That's why choosing the right plan is so important. The good news is, you don't have to guess. There are trusted, government-provided tools that can guide you. Medicare Gov Plan Finder, a free online tool where you can compare Medicare Advantage and Part D prescription drug plans. Simply enter your zip code and medications, and it shows you which plan fits your needs and what the costs will be. SHIP Counselors. For one-on-one help, you can turn to the State Health Insurance Assistance Program, SHIP. This free service connects you with trained volunteers who will sit with you, listen to your needs, and walk you through your best options. Let's look at 2 seniors making very different choices. George, age 76 in Ohio. He has diabetes and takes several medications each month. For him, a Medicare Advantage plan that covers prescriptions and includes his endocrinologist in-network saves him thousands of dollars every year. Linda, age 70 in Florida. She's generally healthy and rarely needs prescriptions. For her, Original Medicare combined with a Medigap plan makes more sense, offering broad coverage in case of unexpected hospital bills. Same Medicare system, 2 very different paths. A big mistake many seniors make is choosing a plan just because it has a lower monthly premium. Cheaper isn't always better. A plan with low premiums might come with very high drug costs or restrict the doctors you can see. The lesson here is simple. Medicare is not one size fits all. You need to weigh your personal situation carefully. Your budget, the prescriptions you take, the doctors and hospitals you want to keep, the possibility of needing long-term or chronic care. Taking the time to compare plans now can save you stress and money later. So, what should you do next? Start by visiting Medicare.gov and using the Plan Finder tool. Or set up an appointment with a SHIP counselor in your state. Don't wait until the last minute. Take control now so your health and finances are protected in the years ahead. And in our final conclusion, we'll summarize the most important takeaways and leave you with a motivational message. You can take control of your Medicare journey. We've covered a lot today. The 4 parts of Medicare, what it does and doesn't cover, the common mistakes to avoid, and how to choose the right plan for your needs. If there's one message to take away, it's this. Medicare isn't one size fits all. Your health, your budget, and your lifestyle all matter. The choices you make today can shape not only your health care, but also your peace of mind and financial security in the years ahead. Remember, enroll at the right time to avoid penalties. Review your plan every year because coverage changes. Use free resources like MedicarePartA.gov Plan Finder and SHIP counselors to guide you. Now I'd love to hear from you. Which Medicare choice feels most confusing to you? Or, if you've been through the process, what's one piece of advice you'd give to others? Share in the comments. We all learn from each other. Before you go, please like this video, subscribe to the channel, and share it with your friends or family who are approaching Medicare age. Your support helps us keep making clear, helpful content for seniors. And remember, your health is your greatest investment. Take the time to protect it, and you can enjoy your retirement years with confidence, dignity, and peace of mind. Life after 65 doesn't have to be confusing. It can be empowered.